Doctor, what is asthma?
Asthma is a chronic disease in which normal flow of air in the airways of the respiratory system is blocked. Airways are breathing tubes taking air into and out of lungs. In asthma, airway cells produce more mucus, which becomes thicker and more sticky. Airways clog up and become inflamed, swollen and very small. Asthma most often starts in childhood. Children have small airways, so their asthma can be especially serious.
Doctor, what causes asthma?
Early onset asthma, which is also known as extrinsic or allergic asthma, has both genetic and environmental causes. Among these are allergens such as molds, pollens and animals, irritants such as tobacco smoke and air pollution, weather, cold air, exercise, and infections. FLU, cold. Asthma runs in families. Emotional stress may also cause asthma attacks.
Doctor, what are the symptoms of asthma?
Symptoms vary from child to child. They include wheezing, which is a whistling sound during breathing, coughing, chest tightness, and difficulty breathing, especially early in the morning or at night.
Doctor, how is asthma diagnosed?
The doctor takes a history, checks symptoms, does a physical examination, and may test lung function, blood, and skin sensitivity. Lung or pulmonary function tests such as spirometry can tell whether breathing is normal and how sensitive the airways are. However, these tests aren't accurate before age 6. For children younger than 3, doctors may use a wait-and-see approach.
Doctor, how is asthma treated?
The severity of asthma can vary. It can be mild and intermittent, or persistent, with daily symptoms, or severe persistent when the patient has constant symptoms. Treatment depends on asthma's severity and involves preventing symptoms and treating attacks. Preventive anti-inflammatory drugs are taken daily for long periods. Long-term treatment involves corticosteroids given in inhalers or pills to reduce lung inflammation. Short-acting bronchodilators, often given by inhalers, quickly open swollen airways. Immunotherapy may help children with allergic asthma that can't be controlled by avoiding triggers. Older children may use small, handheld devices called pressurized metered-dose inhalers or inhalers that release a fine powder. Babies and toddlers must use face masks attached to metered-dose inhalers or nebulizers. A plastic tube device called a spacer should always be used with metered-dose inhalers. Lifestyle and home remedies are important for asthma control. Alternative treatments that may help include breathing techniques, acupuncture, and relaxation. Severe attacks and status asthmaticus may need hospitalization. Do's and don'ts in managing asthma. Do have your child always carry an inhaler. Do encourage regular exercise. Do reduce dust mites in your house by getting rid of carpets and using special HEPA filters. Clean regularly. Do reduce pet dander by avoiding pets with fur or feathers or by regular bathing or grooming. Do learn the symptoms of an asthma flare so you can start treatment at the earliest signs. Don't give your child over-the-counter medicines unless your doctor says you can. Don't let your child come into contact with asthma triggers. Asthma may be related to cigarette smoke exposure.
Mel, tayo mo pa check up. Sige, papacheck up ko mamaya pagtapos natin dito. Uy, si Mel! Hi guys!
Ano ba lang?
Yes, I'm here. Ano, okay ka na?
Oo, okay na ako guys.
Ano sabi ng doktor?
Ayun, sabi niya may asthma daw ako. Tapos may sinabi rin siya tungkol sa respiratory.
Oh my God! Respiratory system. Hindi mo ba alam, ang respiratory system ay yung proseso ng pagpapalit ng oxygen at ng carbon dioxide. Maraming mga sakit na naaagad sa respiratory system tulad ng TB, isa na din yung asthma na sakit mo. Kaya umiwas ka na sa alikabok, usok, tsaka sa mamalahibo ng hayop.
Di na pwede si Monmon sa'yo.
Ang ginagawa naman niyo!
Now, concerning the respiratory system, its major function is gas exchange, getting oxygen from the outside air into your lungs and then into your body for proper cell function, and then the vice versa, getting the waste gas product, carbon dioxide, from your body into your lungs to leave your body. Of course, this works with the circulatory system because it's the blood that carries both the waste, carbon dioxide, and the oxygen throughout your body. Now, most of you are familiar with the major structures, especially the external ones. So through both your nose and your mouth, these are both structures on your face. Of course, your nose consists mainly of those two nostrils, right? Your mouth you're all familiar with when we're talking about things that you eat, talk through. And both of these are where air enters into your system and leaves from your system. Now, your pharynx is the fancy way of saying throat. And this is what connects the nose to your larynx, the neck structure within your respiratory system. So air starts in your nose and your pharynx, nose and mouth, and it goes to your pharynx, and then it goes to your larynx. This is the fancy way of saying your voice box, and it is the piece that connects the pharynx to the trachea. Now, your trachea is also known as your windpipe. You'll see that the trachea is a very whitish looking structure, and it's sort of ridged looking. That's what a trachea looks like. But this connects the larynx, so your voice box, to the next structure in your respiratory system, the bronchus. Now, bronchus is the singular. The trachea leads to the bronchus, one of two bronchus. Plural, they're called bronchi. And these are the main tubes that run from the trachea into the bronchioles. Since it branches off into two bronchi, right, each one goes into either your right or your left lung. Right, and they kind of continue to divide up into different levels, secondary, tertiary, etc., until you get to bronchioles, right? And the bronchioles are just much smaller tubes. And again, it continues to branch and web out. These are made of smooth muscle, and they carry on and continue to break down into smaller and smaller tubes. And so as these bronchioles keep dividing and dividing, they finally end in these structures called alveoli. Now, these are air sacs in your lungs at the end of each one of all these finite branching of the bronchioles. And this is where gas exchange actually takes place, where the process of respiration takes place. If you look at this picture, you'll see that the alveoli, it's the picture in the top right, are covered in blood vessels, completely covered, and that's because that's where respiration takes place. You've got to get that gas exchange of the oxygen that you've breathed into your lungs from those alveoli, those air sacs, into the bloodstream. And the reverse process, you need to get that waste product, carbon dioxide, from your bloodstream into the lungs so your body can get rid of it through exhalation. And again, these are all structures, these are all within the lungs. The lungs, of course, are your major organ in the process of respiration and ventilation. And again, like I say, there's a right and a left, and that's why you have the division of the bronchi from the trachea. And you can see a nice diagram of that in the bottom right hand of it.
Ganun pala yun. Daw.